Hello and welcome to the tutorial on the US Biotech IgG Food Sensitivity Panel. I'm Dr. Starr and this is Nourish TV. In this tutorial, I'm going to explain to you what you're getting in your kit for food sensitivities, and also I'm going to demonstrate with my trusty assistant how to perform this test. So let's get started. Your doctor may have ordered this test if you're having gut issues, or if you're feeling overall fatigue or response to foods. And it's a great test to tell us how we are reacting to the foods that we're eating. So inside your kit, the kits come in a box, and this is actually your shipping box. So you'll be sent home with this box. Inside, we have this silver envelope, and this is where the test strip is placed. This is how it's shipped. It also comes with these two elements that seem benign, and I've actually made the mistake of throwing them away before, so don't make the mistake. This is a moisture absorber. Keep the moisture absorber, and this is a humidity indicator. So this will tell us if the test has been exposed to any excessive humidity, which would alter the results. So keep that on in there. The most important and the meat of the test is where we will collect the blood. And this is a dried blood. So it's just a finger stick. You don't have to go through a blood draw. And you place the blood in these little circles. I'm going to show you exactly how that's done. They're going to give you some Band-Aids, some gauze. Really important to wipe off the finger with some sterile alcohol, and our trusty lancet. Don't worry, it's not as scary as it may seem, and it actually really doesn't hurt, so it's great for kids. Okay, so I would like to invite Dr. Adrienne Stewart to join me for a moment. Thank you so much for coming.
Thanks. Hi, everyone.
She's going to serve as our patient for the day, and you can most certainly do this test on yourself if you have the guts, but a family member can help you out with this as well. So let's get started. So, how warm are you? Hydrated and warm today?
I am.
Great. Oftentimes, it's difficult to get enough blood to fill the 4 circles. So what I like to do is actually soak the intended finger in a little bit of warm water for a few minutes, 1 to 5 minutes, to really get the blood flowing so that you don't have to struggle at the end when you're collecting. So that's perfect for now. Let's get that moistened. So I'm going to put on some gloves. The kit does come with gloves, so go ahead and use them to protect yourself and the patient. And I'm going to move some of this stuff over so that you guys can really see how this works. So here's your collection strip. The collection goes onto this soft paper, and it's really important not to allow the blood to soak through on the other side of the paper. So what you do is you actually fold this over so that the strip is just the paper, and that goes on the counter, and you're going to collect that way. Right, so first things first, we're going to sanitize the hand with a little sterile gauze, and I like to use a real meaty finger. Her middle finger is perfect for that, so I'm going to wipe. And really just one good wipe is good. You can go over it once or twice, and really let it dry for a second before you puncture with the lancet, because that will hurt the patient. Okay, so the lancet is a spring-activated puncture device, and it really doesn't hurt that bad, but it does create pressure. So the quicker, the better. And I really like to do it on the side of the finger so that you're not puncturing right at the pad of the finger where the patient is going to be using their hand later on. So we're going to go just to the side of the center very quickly, and that's it. And if you could turn your hand actually vertical for me, and you can really start milking the blood. You need to wipe away that first drop of blood. That's an important step, okay, so don't forget that. And then really start forming a nice drop of blood on the tip of the finger. That tip. You're going to aim that drop of blood for the very outer left circle, trying not to touch the paper with the blood. You really want that blood to drip, and so use gravity as much as you can to your advantage. Beautiful. There are 2 lancets in the kit. If you do need to stick the person twice, you can, but it's really best to try to avoid that because you don't want to cause too much pain unless it's a family member. Here we go.
But that didn't hurt at all. No, it's
Are you having any pain?
No.
Okay, beautiful. I want to emphasize the importance of filling in the circle 100% without overfilling the circle. And so I'm going to show you up close how that works. Draw that. And then a Band-Aid to protect the finger. Okay, so let's have a close-up so that you can see exactly how much of the circle we filled in. Come on over. Okay, welcome to our close-up. We've completed the test. We've filled the top 4 circles, which is the minimum requirement. If you have a questionable circle, they give you some extras that you can fill if you're not sure. So that just really ensures that we get enough of a sample. But like I said before, when you're collecting your sample, you're collecting it without this cover underneath the sample. When you're drying your sample, you actually use the cover to prop, if you even need to, the sample so it really can dry in the air. Now, the reason that you do this is so that you don't soak blood through the cover, but you do want to soak through the entire other side of your paper here. That's really important. So you'll see these 4 circles, and then once it's dry, it really sits for 3 hours or more. You can do it up to 24 hours, and you close it up. Super important to make sure that your name, date of birth, and date of collection are listed on here. We have had rejections from the lab if they're not on there, so really don't skip that step. And then it goes into your silver bag with the humidity indicator and the moisture soaker, and that goes into this priority mailbox. And this is a USPS, so the label's already provided. You just unstick this piece of paper and you close the bag, and you can drop it at any local post office. This is a very simple collection, painless, we hope, and we look forward to reviewing the food sensitivity results with you. Have a great day.